Psychedelic drugs like magic mushrooms make a lot of us think of the 1960s, but those drugs are making a comeback in a new way, potentially treating depression. So far, the studies have been promising. Stephanie Whitfield has an exclusive look at a new trial happening right here in Texas.
Drugs like LSD, ecstasy, and magic mushrooms have been around for decades. Now, doctors say hallucinogens may help people struggling with depression and PTSD.
I would say it's the biggest and largest multi-site trial.
Dr. Sudhakar Selvaraj says UTHealth is one of 20 test sites in a new clinical trial. They're studying the effects of psilocybin, the chemical found in some species of mushrooms.
It is a medication that can change or alter the perceptions, cognitions, thinking, and how mind sees the environment.
For the trial, 20 patients in Houston will get a low, medium, or high dose of psilocybin. Then they stay in this room for 8 hours with 2 therapists. The idea is the mind-altering medicine helps them see the world and their life differently.
The therapists guide the patients to go through that experience after the administration of the medication. It is not like a drug that's given to someone and then see what happens.
They follow patients' progress for 3 months after the single dose. Dr. Selvaraj says as of now, millions of people suffer from depression and many never get better.
This treatment, if it works, it can help at least a proportion of the people who can get back to their life and enjoy their life like everyone else.